Good morning, and thank you, Paul, for your kind introduction. Lovely. So let me begin with a fictional story about a person who isn't real, but their experience is the daily reality for many people with asthma living in Ireland. So I want to introduce you to Sarah. Sarah is 34. She has moderate asthma and does absolutely everything right in terms of her healthcare. She attends her GP regularly. She takes her MART combination inhaler as prescribed by her GP every morning and every night. Her inhaler technique has been checked and rechecked by her pharmacist. She avoids her known triggers. She keeps her asthma action plan on the fridge. She doesn't smoke, she exercises, and she eats well. She does everything the healthcare system asks of her. And yet, Sarah is still quite unwell. Every few weeks, her chest tightens for no identifiable reason. She wakes up at night coughing. She misses work more than she would like to admit. Some days, she walks her child to school and she feels her breath shorten before she's even reached the gate. Not because she's doing anything wrong, but because of something completely outside of her control, and that is the air that she's breathing. Sarah lives near a congested junction where morning NO2 spikes are routine. The particulate levels in her neighbourhood rise sharply on cold nights when solid fuel burning increases. Her asthma symptoms flow with the same rhythm as the pollution spikes. Her GP adjusts her medication, her pharmacist checks her inhaler technique. She follows every instruction perfectly, but you can't out-medicate the air around you. For so many people with asthma, this is their quiet and exhausting reality. They're doing everything right, but the environment around them is working against them. A little introduction about the Asthma Society. This is some of our team. It's a really nice photo. We do have men working for us as well, but they refuse to be photographed. So we are the National Patient Representative Organisation for people with asthma and their families. We've been operating for over 50 years as a non-profit independent organisation, and we are focused on improving the lives of people with asthma across the country. We do this first and foremost with our services. So we run an advice line and a WhatsApp messaging service, which allows people with asthma and carers of people with asthma to speak with an asthma nurse or an asthma physio completely for free. It's an excellent service and I would highly recommend it. We educate both patients and healthcare professionals. This is central to our work, and we do this through awareness campaigns and engagement. And we also bring about positive change through our policy, advocacy and research work and our engagement with clinicians and the HSE. The Asthma Society has a vision, and that is everyone with asthma in Ireland can live their life symptom-free. Unfortunately, this vision seems out of reach when we think about people like Sarah, people who do everything right in terms of their healthcare, but they are still unwell due to the air that they breathe. So just a little insight into asthma in Ireland. We have one of the highest rates of asthma in the world, with 450,000 people currently diagnosed with the disease, according to the HSE. And that includes, which was mentioned earlier, around 1 in 10 children, and I think 1 in 13 adults. And people with asthma, their condition is not usually taken seriously, but it deeply affects their day-to-day life. So research conducted by the Asthma Society found that on average, people with asthma miss an additional 5 days of school and 7 days of work due to their condition. We conducted a recent survey of people with asthma, which found that for 69% of people, their daily activities were limited or severely limited due to their disease. And there's clear signs that we're not caring for asthma properly in Ireland. And this is seen with our hospitalisation rates for asthma, which consistently exceed the EU average. According to the HSE, half of people with asthma show signs that their symptoms are not well controlled. And most worryingly, asthma deaths are on the rise. We have a 40% increase in the number of people dying from asthma between 2019 and 2024, which is unacceptable considering UK research shows that 2/3 of asthma deaths are largely preventable. A little insight into what is asthma. So it's a chronic respiratory condition which causes inflammation of the airways. These are the small tubes, basically, that bring air in and out of the lungs. And I am not a clinician, but I will do my best to explain this lovely little diagram in the middle. So on your left is a normal airway, a healthy airway, which I hope many of you in the room have. In the middle is an asthmatic airway, and on the right is an asthmatic airway which is under attack or experiencing a flare-up. So during an asthma attack, 3 things happen. The muscles that wrap around the airways contract, squeezing the airways and making them narrower. There's inflammation in the lining of the airways as they become swollen and irritated, and there's excess mucus produced, which clog the breathing tubes further and they obstruct airflow. The result of this is a drastic effect on someone's breathing. The airflow is reduced. The combination of tightened muscles, swelling, and mucus blockage drastically narrows the space inside the airways, making it harder for air to move in and out of the lungs. The body has to work much harder to get enough air, leading to a shortness of breath and a feeling of chest tightness. The rushing of air through these narrow passages causes a whistling sound called wheezing, and coughing is common due to the irritation. Asthma causes the airways to become oversensitive and react to things that wouldn't normally cause a problem, such as cold air, dust, fragrances, and of course, air pollution. These are known as triggers. In order to stay well, someone with asthma needs to avoid triggers and things that trigger their asthma. When invisible triggers saturate the air around you, it is nearly impossible for someone with asthma to stay well. So here's a list of some of the things that can trigger a person's asthma. More could be added to the list, but this is just to give you an idea. And those highlighted in orange are there to give you a sense of why the Asthma Society is invested to improve air quality. We have things like particulate matter, NO2, other things to do with climate change like fungal spores and increased weather events such as thunderstorms really affect a person's day-to-day living when you have asthma. But air pollution is more than just a trigger for asthma symptoms. It also is a significant factor in causing asthma to develop. So research increasingly shows that exposure to pollutants like nitrogen dioxide and particulate matter and ozone, especially during critical periods such as early childhood, can damage developing lungs and the immune system. This increases the risk of individuals developing asthma, even if they have no prior history or genetic disposition. Long-term exposure to poor air quality can lead to chronic airway inflammation and hypersensitivity, laying the groundwork for new onset asthma. This means reducing air pollution is not only essential for controlling symptoms in people who already have asthma, but is also a critical preventative measure to protect future generations from developing this chronic lung condition. So there's a few pieces of research referenced here, including a 2019 piece in the European Respiratory Journal, which found that 11% of new childhood asthma cases could have been prevented every year if European countries complied with WHO air quality guidelines. There is also a 2025 piece from The Lancet, which found that 4 modifiable risk factors for asthma are responsible for nearly 30% of the global disability adjusted life years asthma burden, and one of them is NO2 specifically. And asthma could have been prevented in at least 40% of individuals with asthma by eliminating these risk factors. This research recommends as a primary level of prevention for asthma that, and I quote, awareness of health impacts of air pollution on asthma and other non-communicable diseases needs to be raised, and air quality standards need to be enhanced and monitored to prevent the development of asthma. So what are the Asthma Society trying to do about it? As a charity, we recognise that our resources are limited. We have limited funding, time and staff, but what we can do is support and amplify the work of individuals and organisations, many of whom are represented here today, who are driving initiatives to reduce air pollution and improve air quality. We focus on raising awareness of air pollution as a critical health issue, educating both the public and policymakers about the serious consequences of poor air quality. Our work also involves empowering people with asthma through information and resources and support to help manage their condition and stay well despite the environmental challenges they face. So some examples of the partnerships are up here on the screen, and it was nice reflecting on the work of the Asthma Society as we were pulling these together. We're proud members of the Climate and Health Alliance, which I know the Irish Heart Foundation, Mark, will be speaking more to later, so I won't go into that in detail. We supported the Life Emerald project, which has been mentioned already several times today. We submit consultations to national policy. An example there is the HSE climate strategy. We worked with UCC's Environmental Law Clinic in 2019 to help us develop legal arguments for the nationwide ban of smoky fuels and smoky coal, which we've used in direct advocacy within the Oireachtas. And we have partnered with many people through collaboration, one of which currently ongoing is the Bohemian Project. So this is led by Professor David O'Connor at DCU, and the project aims to enhance bioaerosol forecasting by providing more accurate and localised information on air quality, specifically focusing on the concentration of allergen particles. This is an important project for the Asthma Society to be involved in. and it's a key issue that is likely to get worse in the future due to climate change. So due to shifts in global temperature and increases of intensity of rain in Ireland's climate, pollen season has extended, pollen production is higher, and the pollen particles are smaller. For people without asthma who have hay fever, this means more uncomfortable time for a longer period during the year. But 80% of people with asthma will also have hay fever, and for these people, it's quite dangerous. This is a potentially life-threatening trigger that can lead to someone having a sudden asthma attack and exacerbation of symptoms. As part of the Bohemian Initiative, they're developing an app which will deliver these forecasts directly to users. And it will do things like offer alternative travel routes with lower levels of pollutants and allergens, as well as recommended behaviours to reduce exposure during your travelling journey. Another way that the Asthma Society supports is through linking research with policy change and with action. We regularly engage with policymakers, particularly within the health sector, to ensure that lung health and asthma is prioritised in government agendas. Again, it was lovely reflecting on our work as I was pulling this together. And there's some photos here with current and former ministers for health, with health spokespersons from opposition parties, presentations we did in the Oireachtas and in the AV room, and a nice photo there outside the Department of Health from a couple of months ago. But a critical gap that we routinely identify is the disconnect between health policy and environmental policy, particularly the need to integrate clean air initiatives as a fundamental part of healthcare planning and disease prevention. While it is understood on a logical level that health and environment is connected, there is a disconnect on where the responsibility lies. Through ongoing efforts, we consistently call government decision makers to address this gap by investing in cleaner air initiatives and supporting policies that reduce pollution as a public health priority. And also, someone mentioned it during the Q&A earlier, and I think it does fall outside the remit of this conference, but indoor air quality also is a huge issue that people with asthma are facing on a day-to-day basis. Things like damp, mould, poor ventilation, they're regular issues that we are contending with. So we have 3 short statements on this slide, but they carry a shift in thinking that the Asthma Society is consistently trying to achieve through our work. So clean air is healthcare. Every planning decision, every transport policy, every heating regulation produces a health outcome. They're clinical interventions, they're just delivered outside the usual healthcare setting. Clean air is prevention. So Budget 2026 saw a record allocation of 27.4 billion in health. A key focus of this investment is improving safety and prioritising prevention measures. We believe that every decision, again, made in transport, housing, planning, energy, this is a health decision. Clean air belongs in our national conversation about healthcare as strongly as immunisation or screening programmes. And clean air is freedom to breathe. For a child with asthma, that's the freedom to run outside or walk to school without triggering symptoms. For a parent, it's fewer nights spent in the A&E, and for adults with asthma, it's the freedom to live fully, not cautiously. And as we work towards cleaner air and better policies, we must always remember that there's a person behind every statistic whose health, hope and future depends on the air they breathe. And then just a shameless plug of our advice line. And again, anyone in the room who has asthma or a loved one who has asthma, it's a really excellent service and it's completely free, so I'd highly recommend it. Thank you.